Welcome back. It's 13 after 10 on this Thursday evening. This is News Night here on ENCA. The cholera death toll continues to rise. The Free State has announced that a second person has died of cholera in the province. In fact, the patient is believed to be from the town of Parys. Let's get more details now. Joining us live is Mondli Mvambi, who speaks on behalf of the Free State Health Department. Mondli, a warm welcome to News Night. Just give us the confirmation of the 42-year-old that has been classified as having died from the outbreak.
Yes, no, good evening, and thank you very much for this opportunity. Good evening to all your viewers. We can confirm as the Department of Health that a 42-year-old female demised out of the death is attributable to cholera. And this patient was admitted first at our Parys hospital, and then this patient was then taken to the higher level of care, Boitumelo Hospital in Kroonstad, where unfortunately they passed away. And then upon passing away, the department conducted the test because the patient was admitted, presenting with symptoms that resembled those of cholera, and the swab were taken, and we waited for the results, and it was confirmed out of a laboratory test that indeed the patient has passed away as a result of cholera. So we can account for two definite cases now of people that have demised as a result of cholera. You would remember that previously we had reported as the Department of Health that we had about 9 cases, and out of that 9 cases, there was 1 death. All other cases, 8 cases, were successfully treated and discharged home. And unfortunately, this is the second death that we can account for as the Free State Department of Health.
And in the statement that your department has released, Mondli, you are urging the public to just be wary of misinformation, but to also be aware of actual information that is scientifically based. But you are also trying to deter them from not necessarily following or listening to scientifically supported facts. There's a statement to that effect in your statement. Can you just clarify that for me? What were you trying to say?
In a state of a pandemic, in a state of an outbreak, especially in instances where there are similarities between what people experience as a result of diarrhea and ultimately what other people get tested to test positive to cholera, the symptoms almost look the same, and people tend to believe that they have cholera when they actually have diarrhea, and we are urging, because this can cause unnecessary panic amongst the members of the public, because we have issued all the information to empower people to protect themselves against being infected with cholera, and also being able to circumvent possibility of being infected with diarrhea, because to us equally concerned is people getting infected with diarrhea. So we just want information out there to be scientifically proven, because there are people who had diarrhea, who, when we tested them, they did not have cholera, so it can cause confusion in the public if people not based on any scientific evidence can attribute a diarrhea or person presenting with symptoms that are similar to those of diarrhea as cholera patients. So we want that distinction to be clear, that you are not cholera positive until you are scientifically proven to be as such.
And the people that have died in Frederickfort, Mondli, do you know anything about that? What can your department tell us?
Any person who has died, let it be proven that they died as a result of a specific ailment. And no speculation beyond that should be attributed to those deaths. That's the standpoint of the department.
So you are effectively saying, yes, you are aware that people have died, but not necessarily as a result of cholera.
So people die in various communities all the time. In this particular instance, people die in an area where there is diarrhea and where other people have tested positive to cholera. It does not equally come out as obvious that if you have had diarrhea, you are then cholera positive. No, it's not like that. So we are urging people, should you have symptoms that are presenting as diarrhea, get treated immediately and present yourself to a health facility. Our health facilities are on the alert to make sure that they administer, if not administered at home, because we also urge people to immediately administer oral rehydration solution at home as they go to the health facilities. Our health facilities are ready immediately to admit the person and treat them through the oral rehydration solutions and treat them positively, successfully towards healing and subject them to a necessary test to prove what ailment they are suffering from, so that a proper diagnosis can be made and a proper treatment can be meted then to those people. So we are really urging, present to the health facility, be treated and be subjected to all the necessary protocols that have to do with the treatment of diarrhea and the treatment of cholera, should you be found to be suffering from any of those.
And in terms of laboratory tests, Monhli, how many are still pending from your knowledge? Do you know?
Well, I'm not aware of any that are pending now. I don't have a report next to me here that will point to any outstanding cases so far. But as soon as results become available, we release them without any hesitation, because we think that information is important to be released to the public out there in the best interest of the public and in the best interest of them knowing what to do with respect to protecting their health.
That's Monhli there. Thank you so much for your time this evening. That was Monhli Mvambi, who speaks on behalf of the Free State Health Department.